In this exercise, we'll be using the atlanto-occipital joint. The muscle is going to be the sternocleidomastoid. The origin is the sternum and the clavicle. The insertion is the temple bone, and the action is to pull the head to the side and down. For the next exercise, we'll be using the glenohumeral joint. The muscle is the supraspinatus. The origin is the scapula. The insertion is the humerus, and the action is to abduct the arm. For this exercise, we'll be using the glenohumeral joint. The muscle is the deltoid. The origin is the scapula and the clavicle. The insertion is the humerus, and the action is to abduct the arm. For this exercise, we'll also be using the same muscle and joint as the previous exercise.
The joint is the acetabulo-femoral joint and the tibiofemoral joint. The muscle is the soleus and gastrocnemius. The origin for the soleus is the fibula and tibia. The insertion is the calcaneus, and the action is the plantar flexion. For the gastrocnemius, the origin is the femur. For the insertion, it's calcaneus, and the action is plantar flexion. For this exercise, the joint is the talocrural joint. The muscle is the tibialis anterior and the gastrocnemius. The origin is the tibia. The insertion is the tarsals and metatarsals, and the action is dorsiflexion and inversion of the foot.
The joint in this exercise is the glenohumeral joint, and the muscle we'll be revisiting is the deltoid. In this exercise, we'll be using the hip joint. The muscle is the tensor fasciae latae. The origin is the coxa, and the insertion is the iliotibial band. The action is to abduct, flex, and rotate the thigh medially. In this exercise, we'll again be using the glenohumeral joint. The muscle is the infraspinatus. The origin is the scapula, the insertion is the humerus, and the action is to rotate the arm laterally.
The joint in this exercise is a talocrural. The muscle is the extensor digitorum longus. The origin is the tibia and fibula, the insertion is the phalanges, and the action is dorsiflexion and inversion of the foot. The joint we're going to be using in this exercise is a hip joint. As previously used in the lateral flexion exercise, we are going to be using the tensor fasciae latae. For this exercise, we have the intervertebral joint. The muscle is the erector spinae. The origin is the iliac crest, sacrum, and lumbar vertebrae. The insertion are the ribs, cervical transverse process, and the action is to extend and laterally flex the spine.
In this exercise, we're using the basal joint. The muscle is the flexor pollicis brevis. The origin is the middle anterior surface of the radius. The insertion is the palmar base of the distal phalanx, and the action is the flexion of the thumb.
The joint is a radiocarpal joint. The muscle is the brachioordalis, and the origin is the humerus. The insertion is the radius, and the action is to flex the forearm.